Welcome back to the Line Podcast. My name is Aaron Alexander. This is a place that we bring together the world's leading experts on all things health and wellness to help y'all sort out your mind, your body, your movement, all the things. We got a quote today. I'm going to start the episode because this is a highly controversial episode, so screw it. May as well start with controversial quotes from Ben Franklin. Ben says, "Those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety." Interesting. Those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety. That is a pretty darn powerful message from Ben. This conversation, we discuss what the heck is going on in the world with my friend, Dr. Christian Gonzalez. He is a medical doctor with a very expansive perspective on holistic medicine as well as the allopathic model. And in this conversation, we go over what I think would make a ton of sense for mainstream media to be discussing more of, which is how does a person develop their own immune system? For the most part, people that are being impacted the most from the present state of the coronavirus are people with comorbidities, people that already have illnesses going on, or diabetes or obesity. It's super fascinating, more alarming, that we're following suit with the stereotypical model of Western medicine and looking at the topical remedy of there will be a savior coming. And that's not to take away from vaccines or anything. I don't really have an opinion on vaccines because I'm just not smart enough to understand what the right response is. But undoubtedly, culture, people, individuals, government, media, all of that, it would be wise to also be looking at it from a bottom up, or from what's happening internally with our movement, with our access or exposure to nature, with our nutritional intake, with our sense of purpose, with all of these other elements that impact the way that we produce ourselves at a physiological level. It's unbelievable that we're not even talking about that in mainstream media. People just don't get messages about that. So that was the focus of this conversation. We also get into some of the specific numbers because there's been an immense amount of fluctuation throughout this last 2-month period or so during the whole pandemic shutdown, global crisis stuff. So this was a very refreshing look at what is going on, and just another perspective to chew on. I don't think that there is any one perspective that is absolutely right. Perhaps there is, but I don't know that anybody really knows what the heck it is. And I think this is one that will at least leave you healthier at an individual level, and I think also healthier at a cultural level. I think that this is really valuable information. I greatly appreciate Dr. Gonzalez bringing it to us, and I hope you guys really enjoy it. I really appreciate you guys leaving reviews on iTunes. I appreciate you sharing this with your friends. I read every single review on that iTunes, and it really means the world. If you guys are interested in breaking down how to sit in a functional fashion while you're at home, at your home office, or if you're traveling in your car, any of that stuff, there are some simple, fundamental mechanics that will help you alleviate things like back pain and create a bit more spaciousness in and around those joints around your neck and your shoulders, and they're not collapsing forward, and the forward head posture, all that stuff. And you can learn a bit about that at alignpodcast.com, and just jump onto there and you will see access to a video that I broke down, breaking down how to integrate more effective sitting mechanics into your daily life. It is a big deal. And then from there, there's all sorts of more free stuff. The first week of the online program is completely free as well. We get into breath practices and all sorts of good things in there. So if you're stressing out, we got information for you. I appreciate y'all tuning in, and I hope you listen to this conversation with a open mind and also take this conversation and any other conversation on mainstream media or podcast or wherever with a grain of salt, and really do what is best for you, and make sure that you are taking care of yourself, drinking good water, drinking enough water, eating leafy greens and diverse, colorful fruits and vegetables, and make sure that you are maintaining good social engagement, even if it is social distancing. Make sure that you are engaging. Make sure that you're connected with the world, because that is a big part of our nutritional intake, is socializing. We are social creatures, these human beings. And if we permit ourselves to forego our rights as people, I personally have a tinge of concern that it may be challenging to get those back. And so that is in part why I wanted to release this episode. In large part, I'm going to kind of keep my nose out of all this stuff. But I wanted to talk it out with Dr. Christian Gonzalez. So here we go. Back to the show with Dr. G. How's life been through this whole debacle? We're at month... What day are we at from shutdown?
Who's been counting? Have you been counting?
No.
I can't even find out what day we've been at since Monday.
What is it? What was it, March?
End of
12th?
March?
13th or something like that?
Oh, no, yeah. It was middle of March.
Now is May 7th?
Yeah.
How's it affected you?
Work-wise, business-wise, not too much, which has been a good thing. In a positive way, actually, to be honest. I was able to do a lot more inner work and turn off, like you and me are always running around and involved in something. We're very social people, and it's allowed me the space to actually just turn off my brain, right? Don't have to network today, don't have to be social today with friends, can just turn off and be like, okay, that's fine too. Yeah. Yeah, because I had a lot of issues doing that for quite a while. I've always felt like I need to be doing something. Yeah,
I was saying that as you were saying, the quality of the podcast got diminished, whatever diminished means, but because of, I got to record in my living room now and do all these different things.
Yeah, you got to adjust.
And I've personally found almost a little bit of perhaps a resetting or reevaluation of what is important. Yeah. And part of me, I'm not going to stop doing the podcast, but part of me was just
just take a break.
Do I even give a shit?
Yeah. Yeah.
Which is cool.
It's hit me too.
You're on the train of okay, I guess my downloads, and I need to connect with this part of it. You have all this different, you're in this tunnel vision of what you need, and then all of a sudden the tunnel gets blasted apart, and you can start to reevaluate what you actually need, which I think is actually really cool.
Yeah, I felt like this overwhelming reconnecting to being just simplicity. And I was like, oh, okay, it's this. I was overthinking so much of life before the quarantine. And me just as an individual, how I define my avatar. Mm-hmm. And now I'm just oh yeah, we can make it simple, Christian. Yeah. Or even my capacity for stress. I was getting way too stressed out, way too fast. My cup was filling up too fast. So just able to spread out my schedule has been much better too.
So what's the avatar? What was the perception of the avatar before compared to present?
I think it was just much more connection to doing what I was doing. What I was involved in. And now I'm just now I just want to live in the woods.
Totally. Dude. Survival skills.
Yeah, now I'm
I want to make bunny pelts.
I want to make vegan bunny pelts.
Yeah, whatever.
I'll just I'll forage some berries.
Dude, I've been thinking about that. The value of relationships, which that's the same as always, but that becomes immensely valuable, even if no matter what happens in the economy or with your job or whatever it may be. If you have people that you really truly care about and really truly care about you, that's a big deal. But then having that the awareness that no matter what, I have the capacity to go out and survive outside of this structure, this system. I would wither and cry and wait for a man to support me. If I was out in the woods,
I'd end up being a belladonna leaf and just die the first day.
That's a big deal.
Yeah.
Have you thought about getting weapons?
Yeah, I actually did. it crossed my mind, like if society was to collapse, because it's a good reminder how fragile society is, right?
Yeah.
Like all of a sudden we're fine economically, everything's, people aren't questioning if they're going to get food in the beginning. They're like, where am I going to get my food? Where am I going to get my toilet paper? And freaking out. Like in the snap of a finger, in 1 week, things could just shift.
Oh, dude.
And I do believe that there's so much instability right now in healthcare and the economy and the government that, man, like, it just feels like something is coming to, like, capacity. Something's going to blow. And I don't know what it is. If not, we might be seeing little visions of it now, but I don't know what it is. But something's going to happen, I feel like.
Well, there isn't going to be another normal.
Yeah.
That's not, I don't think that's going to happen anymore. I think that, and it's interesting, like the one thing that I thought was valuable about the coronavirus pandemic hitting the United States was, I think before this, privileged people in the United States kind of felt like that was a thing that happened over there.
Yeah.
Like, oh, that's like some Middle East stuff or some China or Korea.
Yeah, Africa, the Ebola.
Yeah, that's not United. It's not possible.
Yeah.
And so the globalization or the connection of all of humanity and Earth, I think, is much more evident. That what's happening somewhere else, like that, that inevitably is you. Mm-hmm. Mm-hmm. And so I think it likely, and then also it's just humbling people in general. Like there was so much spaciousness to be investing in things that you didn't need to impress people that you might actually secretly resent.
Yeah.
And then you're keeping up with the Joneses, and now all the people that were in that situation, now they're like, oh my God, I need to get rid of all of this stuff. Mm-hmm. And kind of likely go back to something that was simpler.
Yeah.
Which I think that's really valuable.
Yeah, 100%. I mean, that's how I've been experiencing a lot of this. Like, again, simplicity, right? Like I was overdoing everything. Part of my personality, but getting back to just being reminded of the simplicity, even like time for myself. I was like, man, I had no time to myself, and that was by purpose. But now I'm just like, I can turn it off. Like I can read a book today. I can watch a Netflix show. I haven't watched Netflix in so long. Like, I just enjoying just turning it off has been very important. But yeah, it's like we see now how connected we are to nature.
Yeah. As a siren goes by.
Yeah.
We're recording this out in front of my sauna.
In front of the sauna.
Because the sauna, that would be illegal.
People must be on the beach right now.
Yeah.
And they're after them.
Yeah, exactly.
Yeah, but like we are so much more connected. Like this it apparently didn't originate in America. But look how another country's actions can affect ours, right? Like there ain't no borders anymore, right? Like there's a lot more to understand, and hopefully we have more of a global perspective.
So why are we not receiving any education from the mainstream lens on how to be protected from any virus or pathogenic bacteria, anything from an internal perspective, an environmental perspective? And instead we're getting pretty much just fire hosed with like, just batten down the hatches and you'll be saved at some point from this outside thing that's coming, called a vaccine or whatever in 16 to 18 months. Just shut it down, and then at some point we'll come and we'll save you.
Yeah,
it's really interesting to me that we're not really coming from anything, any perspective really, is like information on how to stay healthy in the present moment.
That's on brand with medicine. That's on brand with how we do it. It's like conventionally we will adapt to what is presented without prevention, and then, wait until we can be saved by a drug or a vaccine. And that's what Americans want, right? They want the easy way out. But now we know that the large majority of people dying from coronavirus have comorbidities that are largely preventable and reversible through proper nutrition education, lifestyle choices, right? What's our overall metabolic status? Paul Saladino, Carnivore MD, he said there's so many, he put up a great Twitter. He said there's so many, we're talking so much about preventative techniques for the next pandemic, no conversations around nutritional or metabolic needs. That's wild, right? Because you have, number one, there's people with hypertension, obesity, diabetes, cardiovascular disease, lung disease. Those are the top 5 comorbidities that people are dying from. Like, and these are largely preventable or reversible, based on prevention. But we don't do that. That's why. We're like, right now everybody's waiting on a vaccine that there has been, and this is very interesting for me. When I learned about this, two of the biggest pro-vaxxers, Dr. Paul Offit and Dr. Hotez, we're talking about the unique safety profile or lack of safety profile coming from a coronavirus vaccine. We tried to do it in early 2000s,
Yep.
and the animals were dying, right?
Went into what do they call it? A hyperimmune response?
Yeah, so inflammatory response, and then dying.
Do you know the mechanism at all of how that happens?
Or maybe some sort of overstimulation of the immune system. But the thing is, it's like there's no effective RNA virus vaccine right now on the schedule. You know, so now, if we're waiting 16 to 18 months for all of a sudden the perfect vaccine to come out.
And Fauci was talking about something perhaps in January, which sounds like insane.
Yeah.
It sounds terrifying.
And it's interesting for me that Dr. Fauci totally brushed off hydroxychloroquine, right?
Right.
Completely. And so there's no double-blind studies. But, are they going to do
Nor would
double-blind
there be for
studies
the
on this
vaccine.
vaccine?
Yeah.
It's wild because you have over 2,000 doctors in 30 different countries saying that far and away was one of the most important interventions for preventing death from coronavirus. We're not using it,
And what do you think, but what's your gut reason for why that is?
It's, for me, there's so many medical professionals who prescribe medication off-label, where there's no double-blind studies, right? But to me, if so many doctors are finding that effective, I don't see why it's not being used more. We can go into conspiracy theories, but I can't explain it other than, what do we want to see? Maybe more deaths from corona? Who knows?
Yeah.
To justify truly like a mandated vaccination, it could be possible. I'm one to sit here and question everything.
Yeah.
Right. As are you. Right. We just do it from different lenses, but at the same time, we still talk about things because I don't know many people out here who's like, this is a little crazy. This is a little bit much, especially with now what we're seeing different studies showing that, like, why were we quarantined in the first place? We were quarantined based on the predictive contagion model by Bill Gates, the World Health Organization, that was saying that 3% or so of people, 3.5% of people are going to die from coronavirus who contract it.
Yep.
That was the Surgeon General a few weeks ago said we're ditching that whole model because of its inaccuracies, right? And now we're working with quote unquote real data, and now that real data is showing that it's not 3.5%. It's possible to be as low as over 0.1 to 0.2, which is that's like flu season numbers, So.
And how and why does that data change with time?
It changed with time because we are able to test more, and we're able to see how many more people are infected, right? And the most alarming thing is that there's a massive amount. I believe personally that there's going to be so many people infected who are going to be mildly symptomatic to asymptomatic.
Yep.
Right? Like, oh God, I don't feel too good, and I have a cough and I'm out for the count today. Then you get over it. The problem is that we don't have enough tests to test for everyone who if they have coronavirus, but also we don't even know how accurate these tests are. That's a problem. The PCR test isn't super accurate, and then the antibody test can have there can be estimation of different. The antibodies for a different virus can show up. That's what I'm trying to say.
Yeah.
So that's a big problem. But man, like if you look at, we talk about in Stanford, the one that came out a few weeks ago, the study, and they said 50 to 85 times more people have coronavirus than expected over here in California. That's a lot. That's massive. And then we're like, oh, okay. Well, what about New York? Because New York is the one that's been hit hard, over 2 times more than any other state. And then you look at New York, and recently the New England Journal of Medicine did this study on pregnant women who came to give birth, and they were giving them coronavirus tests. Also, just to have an idea, it's over 270 women. But from the end of March to April, and they saw in these women that there was 10 times more the rate of infection in these women than what they saw in New York City as a whole, right? So they're like, what the hell is going on? And then they saw 88% of those women with the infection were asymptomatic. They didn't even know they had it. That's wild to hear, because how many of us are walking through our state not knowing we have coronavirus. And then the last part is that New York serology study that showed that 1 in 5 New Yorkers have coronavirus, tested positive for coronavirus. That's close to 2 million people in New York alone. So you take those cases, right? So many infections and cases, and you put that against the deaths that we see, which I do believe are still hyperinflated. They're hyperinflated. That brings down the mortality rate.
Why are the deaths that we see hyperinflated or potentially hyperinflated?
Because of the very structure of coding and death certificates, right? So the CDC, their manual says for coding for death should be precise and specific always. Then the coding for coronavirus is not necessarily dying from the virus, but it's with the virus. Dr. Nancy Birx, she's the head of the task force in the White House. She was saying verbatim, she's like, we're taking a very liberal approach to counting deaths. Very liberal. And then she said, if you die with coronavirus, we're counting that, right? So from the top down, there is incentive. There's a financial incentive, Medicare. I'm not suggesting that doctors are coding based on that financial incentive, but that's a problem because there's a big
incentive. Was like massive. I didn't understand how that made sense. It was like 13,000 and
yeah. So that's what Dr. Jensen out of Minnesota said, the family physician.
Is that incorrect?
Well, when I researched what he was saying, there is compensation around that area. That's what the people who were fact checking that and going through that, and what I found is that it's around that area. But what he said, it was like $13,000 per patient, and those who go on ventilator, it's about $39,000.
And you were saying that the ventilator potentially isn't always what it's cracked up to be.
Well, I'm speaking from ER physicians who are coming out and saying, the ventilators may not be working, or they're not taking the proper steps and putting them just straight on ventilators and maybe causing more damage. Now, I'm not an ER physician. I never did rotations in the ER, so I don't really want to get into that space. Yeah. But I'm just speaking from the professionals who are coming out and saying that we don't really know how to treat this. It's a problem. It's a big problem.
And there is a financial incentive to put people on to ventilators. So says that stuff.
Based on the structure, the Medicare reimbursement, yes. But again, like I don't think there's any doctor out there based on how we are, right? What we're here to do, doing no harm, who thinks reimbursement, put them out there.
Right.
But the structure, I don't know. Maybe hospital administrators, there's a problem there. You know what I mean?
Yeah.
So it's kind of a mess. Not only did we get caught flat-footed because of that big lag with the CDC and testing from the first place. They didn't want to take the test from Germany, right from the get-go when we were warned about this. But the CDC wanted to develop their own test. And the test was so faulty, they sent it out to all these institutions, and it was so faulty that it caused a 3-week lag. And in those 3 weeks, that is essential time in a pandemic, right? We have to know how many people are being infected early on. That caused major issues. I believe a lot where we are. That's a big problem. How the CDC handled it in the beginning.
What's happening with pneumonia and flu and all that right now? Have you looked into what the numbers are for that?
No, because I couldn't see. There's nothing. We don't really know the flu. Yeah, exactly. But it is flu season right now. I mean, you start in October. I believe flus will be down. Right. I mean, you can test for influenza, right? But the problem is let's say you have a respiratory disease, and you have influenza, you get over it, but you have the respiratory disease, and you have pneumonia, you develop pneumonia, right? You have a bacterial pneumonia, right? Now you're overtaken by these bacteria in the lungs. The problem is that if you die from that pneumonia, that if, let's say, they took a history and your brother, they found out your brother had coronavirus, you might have had it, or you found to have coronavirus, didn't necessarily kill you. The problem with coronavirus is it's multi-systemic, right? So it gets the kidneys, it gets the lung, it gets the heart, right? So people are presenting and dying from maybe stuff they'd be dying from naturally. If this epidemic never occurred, the pandemic never occurred, or they're dying from those diseases, but they do have coronavirus, but it didn't cause the death. It's a mess for me. That's you can't be nowhere near precise or accurate, just like the CDC manual says, when that's the precedent for everything. You know what I mean?
Yeah. I wonder at what point, what about herd immunity? What are your thoughts on that? Is that inevitably the solution regardless of what we do, or is that What is herd immunity?
Yeah, so I mean that's basically we will build up antibodies, right, as a society. We were talking again. Paul Saladino he was very vocal about herd immunity.
Yeah.
The problem
he had
is
many lashings.
many lashings. Yeah, and you guys can go check out on his Twitter and what he was saying, and he was getting a lot of comments back. But the problem is that for true, it takes seasons. It doesn't just happen now.
Yeah.
It'll be next year, right? The exposures, but as a whole, us being protected, building up the antibodies. But I don't. This is where for me now the quarantine comes into question, where we are now, right? It was based on those really high numbers initially.
Yeah.
Right, where we did think, and then do you remember Dr. Peter Attia? Did you watch any of his videos?
A little bit.
Yeah, so he was putting out videos based on that
prediction,
yeah. Right?
And then he
predictive contagion model, yeah.
Yeah.
But with those numbers, it was showing that a lot of us are going to be infected. There's going to be a lot of people dying. So I was like, whoa, that's pretty serious, right? Because I was also going by the predictive contagion numbers. But once we saw that was way overstated, that was ditched officially, then you look at these numbers and it's like, okay, well, we're still in quarantine. We're home, most of us. We have the luxury of being in California. We can be outside. But, my friends back in the East Coast, it's cold right now.
Yeah.
Still. So they're home, getting hardly any movement. Every single day we're outside. We're training and retraining our immune system. We're not only interacting with people, you and me talk, right? In the air, right? And throughout your house. In the plants, everything. We're always retraining our immune system with bacteria and viruses. We need them. And then we're coming out. We have the masks. We have the gloves. We're sanitizing everything. The question is like, where are we at now? Is the cost benefit a big issue, or should we reassess? Should the sick, like the people with comorbidities across the board, still be quarantined? Maybe the elderly, but even at that, the elderly. We have 1/5 of the deaths in America are from the elderly, or they're elderly. And in Europe it was about half.
I'm surprised it's only 1/5.
Yeah, right
really
now
low.
it is. But again, like we don't know how accurate these numbers are.
I think in
still.
Sweden, last I checked, it was like half of the deaths.
Yeah, half the deaths. Yeah, it's different.
I don't know what it is now. This was probably 10 days ago I looked.
Yeah, so in Italy, when it comes to age, at least in New York, so you have 18 to 45, 0.01% mortality. 18 to 45. That is crazy.
Isn't that kind of strange? That's always kind of thrown me off a little bit that 18 to 45 is together, because I feel like that's putting a 19-year-old beside a 44-year-old.
Yeah, which completely different immune systems.
I don't know. That's anytime I see that, it's like, or when we're seeing that, does that mean that like it's essentially 40 to 45? And they were like, it's 18 to 45. I don't know. Maybe I haven't looked specifically into it. But it feels like those are strange numbers to be together.
Yeah, I mean, it's a large range. But I mean, that's what 0.01% of the people. But then you look on the CDC website, the elderly population, the hospitalizations are on par with the amount of hospitalizations they have from influenza, which is wild, right? Like, so I think a lot of it is we're seeing a disproportionate amount of hospitalizations in one place. See what I mean?
Yeah.
Whereas if you diffuse it throughout America, so let's say flu season, right? Deaths and hospitalizations. If you diffuse it throughout America, right, we go, okay, people are dying, but we don't really, it's not news coverage because all those people aren't going into one hospital or one city hospital, right?
Yeah.
So imagine all of the people who are going to die of flu come into all LA hospitals. LA would be going crazy, right? Kaiser, UCLA, Stanford, it would be nuts. And I think that's what we're seeing. A lot of these disproportionate experience with corona is happening in New York City.
Yeah.
So not only are elderly people are going, 0.01% of young people are dying from it, but now we're seeing like low socioeconomic communities, which happen to traditionally have comorbidities like diabetes, hypertension, right, heart disease.
And why would that be?
Well, I mean, if it's anything like where I grew up, you're not going to see health food stores. You're not going to see Whole Foods. You're going to see a lot of concrete. You're not going to see, a lot of parks. We don't value it like we do in LA. And LA's been a very different experience for me from the East Coast because I'm like, where are all the people who are smoking?
Mm-hmm.
Right? Even smoking status, like it's insane. Like the people who are dying from coronavirus, a lot of them are smokers too. So now I'm like, where are all the smokers? You go to New York, you'll guaranteed see someone smoking on the street.
Yeah. Not to mention likely living in an ongoing stress, fight, flight fear response of sorts.
We're a little more stressed.
Yeah. I mean, like what is that? I was listening to Noam Chomsky, an interview this morning, and he was just referencing the financial state of most people, and most people are actually in debt, and the people that actually own the wealth is, from what Noam Chomsky said in this interview, I listened to this morning, fact check it, but 0.01% of the global population has 20% of the world's wealth, and then like over 50% of people can't afford a prize $400 bill, I think it was. And there's so many people are in those situations, and it's like, that's not a healthy physiological state to mentally, emotionally be in that place of always wondering if, am I going to be able to feed myself, feed my kids at the end of this month?
100%. And that's what's happening with the economy. But you just think of New York as a whole. It's like the lower socioeconomic parts, the closest restaurant, the closest supermarket was like a bodega, right? That's like a corner store that sells it's like a convenience store that sells like even crappier foods than like 7-Eleven.
Yeah.
Right? Pastries and sugar cereals,
food
sugar
desert.
sodas. Yeah, like this is our access to food in those communities are horrible. And, you're obviously not going to find a Whole Foods because, it's going to be more expensive, but like even finding a variety of produce is hard. And that's sort of like the neighborhood that I remember growing up in, and it hasn't changed much because I visit New York a lot. And my aunt went to the hospital with coronavirus. And she's obese, and she has diabetes, and she's coming from the Bronx, in the community which I know very well. So this community is hit so hard, and these are the people that need the education the most about not only nutrition, but like you said, movement, getting sun, grounding, anything, like just how to shift their lives and having better access to food, because the food corporations have a really strong hold in those socioeconomic communities in New York City. And look, they're getting hit so hard.
Yeah, and they're also looking from like a microbial perspective. The foods that they're eating aren't really the optimal to create a healthy microbiome, and then that gets into hyper-sterilization. So now all of a sudden a person starts getting sick, or they see some stuff on the news that they need to sterilize everything, and meanwhile the food that they've been ingesting for the last however long has been sterilized itself. And now we're in this place where it's like, we actually really are vulnerable. Because we've been in that bubble.
Yeah. And how many of those people got the flu shot? Because there's an armed forces study that showed 36% of people who had the flu shot are going to be at increased risk of getting coronavirus and getting sick from it.
Why would that be?
We don't know.
Oh, interesting.
But that was the armed forces study from last year. Because I know in those communities, they push the flu shot hard. You go to CVS, you go to Walgreens, right? It's everywhere. They're pushing the flu shot. So that's another question we have to think about.
The people that got the flu shot are more susceptible
to coronavirus. 36%.
To fatality to it, to hospitalization, to just contracting it in general?
Yeah.
Okay.
Yeah, 36% more.
Interesting.
Yeah. Armed forces. That's the Armed Forces study of 2019. They did it in the military. Yeah, wild, right? So, but now it's funny because I get a DM from someone in Australia saying the Prime Minister is pushing everyone to get a flu shot. I'm like, did this person read this study, or who's his counsel? It's wild to me.
What's your stance on vaccines? I'm laughing just because I know it's like a nuclear question.
That is,
and you don't even need to answer if you're concerned of.
You have to do an
lashings.
Yeah. My concern is that, there is some concern because for safety studies for sure. I haven't fully been able to answer that question. I do have my opinions on it. I think it's proper to question them.
Yeah.
100%. Because of the lack of safety studies. And I absolutely don't think that they're safe for everyone. 100%.
Is there specificity to what vaccine would fit each individual biological makeup, or is it work that way, or does everyone just gets the same one size fits all?
Yeah, we all get the same one.
Yeah.
Yeah, and think about just autoimmune disease in itself. That's a population in itself that can be theoretically affected pretty bad by any vaccination, So I think that if we want to make them better, we have to learn how to at least biochemically make them more individualized for people, because people with autoimmune disease, they can get really, really sick.
Yep.
And that's my concern. If there's a mandatory vaccination, many people are going to die. Right? Because you can't just put a one. Remember what I said about the coronavirus vaccine back in 2000? We It has a unique safety profile. It can cause a immune response, inflammation, death that we saw in animals. It can also cause an antibody response where literally getting the vaccine can be worse off for you than just getting the virus in itself, right?
Yep.
Because there's an amplification with the antibodies. And this is not like me being like, oh, I read a study and I'm just talking about it. This is from the top of the top people, right? Top pro-vaxxers, Dr. Paul Offit, Dr. Hotez. This is exactly what they're saying. So I'm concerned about any mandatory vaccine.
Yeah.
If it's not mandatory, you better believe I'm not getting it.
Yeah.
There's a lot more that we can do from lifestyle, nutrition, even supplementation, for me, that goes a way longer way than all of this.
What are those things that people should be thinking about or could be thinking about?
Yeah. So, I'll preface this by saying that there's no study on let's say andrographis, which is an herb, and coronavirus, right? So this isn't like medical advice or prevention. All I'm saying is that the things that I know work for the body and that I would give my patients. Okay.
Yeah.
So obviously nutrition is most important. So whole foods, right? How much whole foods are you eating as a whole? Because most of those antioxidants that you're getting are going to be protecting you. So we have to think about lung health, respiratory health, right? That is the number one place you're getting affected by this virus. So vitamin A, vitamin E, vitamin D, they show that folks with vitamin D had more, the folks with a better vitamin D status had less severe symptoms versus those with severe symptoms and less critical conditions, right? So basically, better vitamin D status, the more mild you are if you have coronavirus or if you contract coronavirus. So vitamin A, vitamin D, vitamin E, mucin is an antioxidant that belongs that's in the lungs.
Where does one get these vitamins from, if not just supplements? And if supplements, where's the best source?
Yeah, so you can get them. You can get vitamin A from food. I know you eat meat, so people eat organ meats for this stuff.
Yeah.
You can get them from just animal meats in general, but you can also get them from plant-based stuff too, right? Like the orangey stuff, pumpkins, butternut squash, carrots, different nuts and seeds. Same thing with vitamin E, nuts and seeds. You get them a lot. Beans, legumes. Vitamin D, man, this is the importance of being in the sun. Like, this is why I talk about the sun so much, at least getting an adequate amount depending on your skin color, right? So the more whiter you are, you can get maybe 15, 20 minutes. The more darker skin, you're going to be at 3 times lag. So you need 3 times more the amount of vitamin D. So for me, I'm out for like an hour, because I'm pretty dark. But mucin is stimulated by prebiotics. And that's a very important antioxidant to protect your lungs, mucin. So, artichoke, dandelion, chicory root, garlic, all that stuff, all the good stuff. And one of my favorite ones is glutathione. Glutathione you can find in different foods. Yes, you find them in animal foods and plant foods. But the thing about that is if you cook any of those foods, it's going to lose a massive amount of glutathione. So, and this is a recommendation, medical advice, but I use glutathione under my tongue, liposomal, every day. The minute I found out it was like this virus and it's going around, I said, all right, let me just increase my glutathione status in my lungs. And that helps balance pro-inflammation in the lungs. It's one of the most powerful things. Vitamin C, everyone should be either eating vitamin C foods every day, which I am, like bell peppers, guava, or citrus foods, like every single day, papaya, or supplementing with it for sure. Vitamin C it is so classic, but so important for this. Even IV vitamin C, man, they should be giving this to people who are going to the hospitals.
Isn't that crazy?
I can't believe that. I mean, there's you can see in the Lancet that it reduces acute respiratory distress syndrome and reduces mortality. This should be in every single hospital in America, IV vitamin C. But I have nurses DMing me and say, hey, look, I spoke about IV vitamin C with the doctor. And they laugh. They're just like, no, it's not part of our protocol. Are you crazy? And it can be saving lives, IV vitamin C. So, I mean, those are some of the most powerful things. And there's different herbs out there too. But supporting your immune system. But the better thing is eating good nutrition. Right? Whole foods, different colors, variety, going outside like you always preach, getting in the sun, taking off your shoes, grounding, breathing, that's going to be the most important things we can do.
I wonder if all of this is creating more of a cleavage between more like holistic medicine and traditional like Western medicine, or if it's merging.
It depends. It depends on who you talk to, right?
Yeah.
I did a podcast, a Medspiration podcast, which is really big allopathic medical podcast, and we both were talking about like the Venn diagram and how we have to meet in the middle. Like, this should be, if anything, a teaching lesson for how do we prevent those to never get to the hospital.
Totally.
Right? And we have, as naturopathic and functional doctors, integrative doctors, those tools to help people and just practitioners in general, just as a whole, to never get to the hospital. But when we go to the hospital, we sure as hell need the best, right?
Yeah.
If I have coronavirus and I'm really sick, I want the best out there. So we have to. It's important. It's really important that we can maybe find some integrative love between each other. Because, for me, I've never wanted to be dogmatic where I'm like, this, not this.
Yeah.
At the end of the day, it's medicine, you know.
Yeah. I wonder what your perception of mask usage is. How valuable are masks? Are the people wearing masks alone in their car? Does that make sense?
Yeah, I
saw an interesting meme about masks. Yes, it was, I forget what the guy was, but it was, I wonder if the people that wear masks, and maybe this is the right decision to do, I don't know, but the people that are wearing masks alone in their car, I wonder if they lie alone, naked, in bed with a condom on.
That's good.
Powerful meme.
That's a good meme. I just pictured the meme and how it would look. That's why I just laughed. It was a really good one.
It was, it was the meme. The meme's been powerful these days. They're good.
I mean, it's not clear cut. Like, for me, it can reduce respiratory droplets, right? So if I sneeze in a mask, it's going to be contained.
Yeah.
There's a double-blind study that just came out that shows, well, maybe masks are not as protectant as we thought. And it actually can make people more confident, being like, oh, this person has a mask. I can get much closer to them, and it's fine. But for me, I put on masks when I need to. Like, let's say I need to go to the store, and they are mandating it.
Yeah.
But you better believe I'm walking the streets of LA. You know, I want to breathe in the air.
Yeah, it's wild, man.
Yeah.
I got a man threw a bag of dog poo. Did I tell you about this?
Mm-mm.
I was out for a run. I was with my brother, and we're, running. It's like hot, shirt off, sweating, going down the street, whatever. I think me and my brother, we were probably, 5 feet away from each other or whatever. It wasn't anything, especially close to each other. Weren't wearing masks, not around anybody. And this man honked his fucking bag of poo hit my brother, didn't hit me. And I didn't even understand what was going on. I was confused. I thought his poo bag flew out of his hand or whatever. Yeah. And then I turned back and he's like screaming about
wear a mask.
Yeah, all this stuff. And then I couldn't understand because he was wearing the mask exactly, but I heard him yelling about masks or whatever. And it's interesting what it's doing to people. Like, it's very divisive.
It is. It is. And I saw a clip of, or I read a quote from Anthony Fauci before this all happened, speaking about how, like, masks are going to be making people overconfident, and it's not something that, is going to protect us the way they think it's protecting us.
Yeah.
That was from Dr. Fauci, and, like, when I read that, I was like, wow, this is before all of this, and this is the same guy who's like, we all have to be wearing a mask.
Yeah.
I do think it makes people overconfident as a whole. I think it takes away from us interacting with our environment. And I think if we are planning, I don't think we should be around elderly people. Like, I wouldn't see my grandmother or grandfather if they were alive right now.
Yeah. Is the societies that have followed a strict quarantine, are they potentially setting themselves up for another bounce back as opposed to, like, more of a Swedish approach? Which is strange there's not more control countries like Sweden to be able to test off of. Is Sweden like the only one
country that really did it? That's the only one that I know of,
Crazy.
It is crazy.
But it makes sense in my mind that they will have a more consistent kind of gradual, slowly the herd sorts it out. But then it's like, well, Sweden's Stockholm's, have you ever been to Stockholm?
No.
Yeah, I don't know what the population of Stockholm is, but it's not New York City.
No.
So perhaps it's a different place. Maybe it's incomparable.
Yeah. And that's where I'm, like, hoping that we reassess this quarantine, because at this point, again, we're based on these old numbers while we're being quarantined, and I think we should reassess and go, okay, like the older, the sicker population, those with comorbidities, maybe they need to be still quarantined.
Why aren't we doing that?
I have no idea. I can't even go into that without speculating. You know, like who knows, man? Who knows? I haven't seen anything hard out there. I guess the belief is that we're still being protected or flattening the curve, you know. But when there's massive amounts of hospital around the United States that are empty, that are furloughing their people, you know, their workers, it's interesting to me.
Why is it that New York got hit so hard and so many other places are furloughing their employees at hospitals?
I definitely think it's a population thing. It's a socioeconomic thing. It's comorbidity thing. Like, that's my belief, right? Because we have people with comorbidities, you know, like the down south, Mississippi and Alabama, they're really sick states.
Yeah.
But the population they're much less concentrated than New York, right?
Yeah.
You have people living on, you know, this farm and then, you know, over there. But in New York, you're on top of each other. I mean, you're always on top of each other. Every building is on top of each other. I think I think that's one of the biggest factors right now. The biggest factor being that I think the comorbidity, the people who have diabetes out there and hypertension. There's massive amounts of people in New York who have it.
What happens to a person where they become fearful of bacteria and fearful of, like, bacteria is bad, so I need to be sanitizing every surface, and I need to, I touched 15 surfaces today and I sanitized properly after each one. And
and that's how we're doing it.
Like that person, what happens to that organism?
Yeah, so that organ. I mean, we didn't evolve sanitizing, right? We evolved rolling around in the dirt.
It's wild.
You
man.
know, eating food with dirt on
we
it.
needed more dirt to begin with.
Yeah,
and
exactly.
And now it's like, let's just ramp it up to 10.
Yeah. so like we're of this world, of this earth. We're of nature, right? And as part of that, like the plants we see, or like the possum that crosses a road, like we should be interacting with that as much as possible. And I know you do a great job of that because you're always outside and with your shoes off and breathing in the air and interacting with it, putting your feet in the water, whatever it is. We don't do that. And remember, I just mentioned, like, we're supposed to eat some foods with some dirt on it, right? Because we're training and retraining our immune system and our microbiome, right? Those spore biotics, right, in the soil. Those folks who are over-sanitizing, we shift our immune system. Right, and then with that shift, we predispose ourselves to other diseases just because of that shift. So we're sanitizing our microbiome, and we can do that, right, with different sanitizers, hand sanitizers every single day, affecting our skin microbiome, right? Breathing in all of that crappy, those chemicals that we're doing to sanitize our tops, that's affecting our whole body as a whole, and our immune system is shifting and predisposing us to other diseases. So how protective is it? For me, the best thing that we can do is train our body to be exposed, not be stuck in a hyperhygienic apartment, but really train our body to be exposed. I'm hoping that things start opening up and we can start interacting with people, right? Because again, that's how we exchange bacteria, right? In the air we breathe. It's so important, and that's how we train our immune system. That's how we protect ourselves, you know?
Yeah.
But the stress of, like, being home, the stress of losing our jobs, the stress of being home with domestic abuse partner, can you believe, you know, like, how much more damage is that going to cause? I think we'll see it later, not only the economics, but psychologically, how people are being affected.
Yeah, and I think now more than ever, it makes people more complacent and, you know, perhaps more complicit with going into a place of greater separation, because, like, well, I can just do this Zoom call now.
Yeah.
I don't need to meet up with Christian. I don't even need to wear pants. I don't need to take a shower.
Yeah.
Just press the button, stare into my screen for another hour.
Yeah.
You know, and then once I finish that, I'll check my notifications, and then I'll get on my emails, and then I'll jump on the news to see what's going on.
There you go.
And then I'll maybe jump onto that YouTube video. Oh, it got taken down.
Yeah, exactly. And we're losing that. And you and I, before this quarantine, were talking so much about the importance of community. And where is the community now? Not only just like, oh, you know, I feel good seeing my friends, we're hanging out, but like literally the physiological effects that it has on us as a whole, and connecting to that. And that was one of my top 5 things for 2020 when the new year started, was community was on there for this year to really focus on. So I think more than ever, I hope more than ever, once this opens up, there'll be more community outside of like people going to the bars, but like really like being like, oh yes, like now I can really connect with those people who I was Zoom calling, you know, every week.
Yeah, it's weird, man. When I see people hug on the TV, I get like thrown off.
Yeah.
Like it's seriously. I see it. I was like, and at first I want to like snitch on them. You know, I want to call somebody and be
Yeah.
like, they're breaking the rules. I don't actually want to do that. That was a real thing though. For
a little bit.
For a little bit.
Yeah.
Yeah, you got to snitch.
For a little bit because we were believing that we were flattening the curve, right?
Yeah.
Based on, again, that model where we thought there was going to be a massive amount of infections, a massive amount of deaths. And again, the hospitals that are being overrun, there's more that are much more that are not being overrun versus the ones that we see like in New York, Pennsylvania, New Jersey, Chicago, Michigan, you know.
I wonder what the psychological / biological, but the impact of the way that we think and perceive the world, ourselves, each other, the bacteria, invisible, all the different invisible enemies that I'm bathing in all the time. I wonder what that does to a person's mind. And I wonder how that trickles into the way that the person's cells manifest themselves. And like nocebo.
Yeah.
Do you think that there's any relevance of that, the way that we think and perceive the world, to impact the way that we generate at a cellular level?
Yes, because our thoughts are connected to our health. Absolutely. The way I think perception can shape our reality for sure, but not only just the reality we experience, but like our physical reality that we experience, our body's reality, right? So, just think about it. Like, I could start talking to you about like your favorite food, and you'll start producing salivary secretions, right?
Yeah.
So for sure, the perception is major, but again, like we evolve with bacteria, fungi, viruses, right? We're starting to learn more about the microbiome, right? That is all of these buggers, but we know a lot about the bacteria. What about the virus or viome? Like we live in conjunction with viruses, and I truly think that we're only focusing on how we can villainize these things that we catch, but not really focusing on like, well, does it benefit our immune system at all? As we were talking about, maybe low grade amount of Epstein-Barr virus is protecting us without even knowing. I think we definitely focus, and that's a germ theory, right? Like you catch a germ and the germ kills you and you die. Great, but like I think we're at a place where we need to start looking at things from the bigger picture. Like I always think when you have like a fungal overgrowth, like say candida, like why do some people have so much more candida? Why do, when people eat some sugar, they overgrow this fungus in their intestines or their mouth or their vagina or their penis? Like why? And sometimes I think that network of fungi is protecting us from other things, maybe toxins. How do we not know that these buggers aren't absorbing toxins? So that's what I'm trying to say. Like, instead of villainizing, let's look at our body as a whole and question, like, why? Why is it working together, maybe to our benefit more than we think?
Yeah, I wonder what it takes for a person to get back to a point to kind of heal the mental, emotional scarring of this experience, to be able to recover themselves back to a place of being able to welcome the outside environment.
That's a good test, because I was thinking about it the other day. I'm like, let's say everything gets lifted in a week. Like, hey, we're back to normal. Go be back to life.
Yeah, you're still shrunk up.
How many people? You think you think everyone's gonna go see a Billy Joel concert? You know, like what? How long is it gonna take till we see that normalcy? I hope that we come back to normalcy, but our mind never goes back to normalcy, because we always question what the hell happened. We always question how America got hit so hard. We always question what went wrong in the government, right? I personally love how people are questioning everything now. This has been such an experience to see people like sending me stuff saying, hey, you've been saying this since 2013 when you were in your residency or in school, and then when you were in residency, you were talking about this. Now there's people putting out videos about this. Like, I love that. I love that my friends who are like very by the book and like, this is how it is, and what conspiracy? Now they're talking about it. It's like really cool, because I do think that there's a shift in the collective consciousness.
Presently, this conversation is not illegal yet, but it would certainly be removed from YouTube.
Yeah, isn't it crazy?
Yeah.
Free speech gone. Isn't that where
It's
are we
going.
living? Yeah.
It's not gone, but it's going.
It's going.
Like it's like in your fingertips and it's getting pulled out. It's like a dog like holding onto a frisbee and the master's kind of he's got the angle on it. It's like pretty much
like I almost got it.
You got a tooth on it.
Yeah, but it's wild. It's wild because let's say you and I did a documentary just questioning everything, putting some people's experiences, speaking with some experts, and let's say we work really hard and we put that out there and it spoke truth. It was based on all these facts, right? It was heavily factually presented.
Yeah.
That can be pulled down as long if it's not following some weird narrative.
Yeah, you can't say it.
Isn't that crazy?
And again, once again, it goes right back to, in the beginning talking about how I think Americans, feel like this is something that happens out there. The diseases. Oh man, that's the SARS and the MERS. That's out, not in America.
Yeah.
And then we see like China and North Korea and like, oh yeah, they only get to see what the government lets them see.
Exactly.
You're like, not in America. And then all of a sudden you want to share a video with a friend and say, look, this is like a really well done, everything's fact checked to the gills, and it's on the internet for 2 hours before it gets
crazy. And that. For me, and same thing with doctors, right? Doctors coming out doing videos, boom, pulled. Like I've gotten smart enough to screen record all of these things now, but
yeah, right.
What does that tell you? Like, what does that tell you? Because if it's factual or doctors' experiences in the ER, right? Them talking about what they're seeing, right? What they're seeing with these patients, what they feel about these treatments, right? Or these documentaries, all factual. What's that saying? Like, anything that challenges the narrative is being quieted fast. That's concerning, right? Because if it's quieted fast and it's factual, then what's going on, right?
Yeah, I mean that to me makes me more skeptical of the narrative than anything. If the person's honest with a thing, whatever the situation is, there's nothing to hide. Say what you want. It's once the person knows that they're in a place of like, they're hiding something. I'm not saying this is happening or is not or whatever, but just like basic psychology. That's when the person starts getting kind of shifty and starts, maybe gaslighting people and doing weird kind of things. Like, no, shut up, and you're angry and down.
Yeah, I know.
And that's like, what?
And that's what's happening.
But the person that's like really going by the books and like, dude, I've been honest every step of the way. Yeah. You can say whatever you want. I don't have anything to hide from you.
Yeah, I'll show you.
Here it is.
Yeah, you're wrong.
You could say something there like, fine. It's a weird thing to see that trickle up into the way that we consume media.
Yeah, and again, like one of my first interventions is stop watching TV. It's interesting that we're quarantined and really majority of America is going to put on the TV every single day. Right? If we're home, that's what we're going to do. And God, like what the media has done, I watched like 3 days of the news and I said, I'm never watching this again. I'll get my news, I'll check numbers, I'll fact check that. But the way the news is putting this out is like, it's the end of the world. It's the epidemic.
Well,
you're going to get sick.
that's the case with the news since forever.
But even still, it's wild.
Well, who's the comedian? It might have been like Louis C.K. or something
George
like that.
Carlin, I think.
George was the one where it's like you're watching the news and it's like there's asteroids coming down and dogs biting people's arms off and babies are dying and it's like, oh my God, you're like crazy. You're inside your little box and then you walk outside and there's just like birds chirping in the sun and people waving at each other. And then you go back in like, I'm going to go check out the news. And just right back into it the next day.
Yeah, riots and looting.
It's crazy.
Yeah. So I think anyone who's listening, and I think most of the people out there, I know your listeners, are already like really educated about like empowering themselves. But if you're still watching the news, like just question, because the news isn't going to give you factual evidence always. I promise you that. We see that with the numbers already, right? There's a big discrepancy in the numbers of deaths. But like, just go to like the official websites, check it out. But that energy is not for you.
Well, the news is vying for your eyeballs just like any other media platform.
Yeah, they're making money.
And so if you're getting sensational media is going to be what engages people. So if you can get all of somebody's sphincters to clench up by just seeing the little heading, you're like, okay, cool, they're gonna get into that.
Yeah.
And so then you end up it becomes this avalanche of like, just keeps going deeper and deeper into that direction.
I want someone to send me a clip of saying that 0.01% of New Yorkers 18 to 45 die from coronavirus, because that should be a headline, right? So we know, at least if I'm a New Yorker, let's say we're in New York, we go, well, I'm 36 and you're 20, 32,
33 in a month.
Wow, we are glowing.
Coming up.
Yeah, but like, wouldn't we want to know that? Like, oh, wow, okay. You know, one news media is telling me I'm going to die from coronavirus, but then this headline of 0.01%, that's almost no one.
Have you seen the creepy line?
Lion?
Line.
No.
L-I-N-E.
No.
Linea.
No.
Yeah. Do you speak Spanish?
Yeah.
Okay, cool. I wasn't sure if that was offensive.
Yeah. No, that's fine.
So the Creepy Line's a documentary. It's on Amazon. So if you have Amazon Prime, which I imagine probably everybody does, you can just play it now. And it gets into the creepy line is, at what point does your smart technology go too far with surveilling you, essentially. And I'm not, I personally, part of me doesn't really give a shit if somebody knows, the crap that I Google search and they're advertising me that for all those reasons, all that stuff. But one of the things that's interesting, and then part of me, I think it is very interesting because, I have a Siri thing in my place. Probably a lot of people have some form of that, your phone, whatever it is. All of that stuff can be tracked and dictated. So as you're speaking, when you can talk into your phone can dictate that. Like, that's your Siri. All that stuff can do that. It can be saved.
That's wild.
So we haven't had the full story of what type of surveillance is happening. Like, things leak out and they're like, oh my God, that's crazy. It's like, well, that's been happening for a while.
Yeah.
So these certain things leak out. And one thing that I am interested in, I wouldn't say like overly concerned about, but it is interesting, is, I think it would be fascinating with, we have this smart technology in our house, your microwave, your, whatever. If it could perhaps this is happening, but it could flag certain words.
Yeah.
Imagine every time you're joking with your friends and you're talking about fill in the blank thing that would charge up the man.
Yeah.
It could flag that. I'm just making this stuff up. But it could flag that, dictate that, and kind of go into your Dr. Christian file. And that's just some crazy shit that I was thinking about earlier that kind of freaked me out. The reason that I'm mentioning that is one of the things they get into is the power that Google has, or Facebook, or any of these media platforms that are supposed to be completely neutral, the power that they have on shifting people's perspective on politics. So all this stuff, it's like, okay, cool, they know that I'm into blue shorts, now they're hitting me with all these blue short stuff. Like, whatever, no big deal, it's just advertising. But when you Google search something, or looking at your Facebook trends or whatever it may be, and you see, oh, there's more of, this prerogative or this political perspective, whatever it may be, that's been shown based off of the research that I saw in this Creepy Line documentary last night, to shift people's political perspectives. Wow. It was like 63%. Wow. Of the time, it would shift their perspective over to that thing. And then if they when it was blatant, I'll shut up in a second, but when it was blatant with the search results, they were like 3/4 of the people would be like, oh, it seemed pretty blatant. When they just shifted it up just a little bit, it cranked up to 83% didn't notice. When they shifted just a little bit more, still it shifted their perspective. I think the number was 63% of the time. And 100% of people didn't notice anything. Wow. And that's happened from what I saw in this documentary with Facebook. They were leaning more towards liberal perspectives, and so they would kind of cut out conservative stuff, and all that stuff is fine. Like, that's all the news networks tend to do that. But when the platforms such as a Google, everyone's got that in their phone, they reach in, they type in things, it's said to be just a completely neutral source. It's actually a potential massive
big influencer right there.
Big influencer.
Which is scary.
It's pretty interesting.
And is that like a microcosm of what happens across the board? Are we just not noticing it? Like you said, like those people weren't noticing it.
Yeah.
Are we just not noticing? Like what we're being fed, which is why I don't watch TV.
Yeah, we're malleable creatures, man.
Yeah.
Programming.
Yeah. The best way to influence is create separation and shit. TV's been doing that forever, right? Politics been doing that forever. So it's like, I think we're at a place now where there's so much separation, there's so much fear, right? Fear. And those two is the perfect formula for control, right? We're looking for a savior. Like,
Yeah.
tell me that
just get me out of this thing. Whatever you need. Just get me out of this thing.
I want to get back to work.
Yeah.
Right. I don't want my grandma to get sick. I don't want my aunt to get sick. What can we take?
Yeah.
Right. And then here comes our savior with a vaccine, Bill Gates.
Yeah.
You know, it's crazy. It's crazy.
Yeah.
It's crazy where we are with this. You know, a vaccine that that the two biggest pro-vaxxers are saying that is not safe. We couldn't find any safe vaccine when we tried. But now they're rushing it for what you said, like January, February. That's crazy. You know, so if it's mandatory, you will see me fly to outer space and live there because, you know, like there will be no way that I would be getting it.
Well, I'm hoping to be able to pay off a doctor like you. I'm going to be hitting you up. Say, Dr.
Exactly.
G,
yeah,
what
right?
do I got to pay you?
Exactly.
I bought a gold bar during this thing. I'll flip you a gold coin if you give me the check mark.
At this point, yeah, exactly. At this point, a dinner from like Gracias Madre and Cafe Gratitude will do.
Okay.
I haven't been to those restaurants in forever.
Oh yeah, good point.
Yeah, I miss those. So
yeah.
Right. And that's what it is, man.
All right. Well, thanks so much for doing all the work to understand to the best that any of us can.
To the best, yeah. No one understands out there. Anyone who tells you, like, if there's a ER doctor who tells you exactly what it is, they don't know. You know, no one knows. No one knows right now. No one knows how many people are dying. No one knows how many people are infected. We have ideas. I personally think it's way more infections, you know, way less deaths. But, you know, this is where we are right now. This is the state of the coronavirus.
Damn. Well, that's the name of the episode, State of the Coronavirus.
There you go.
All right. Any final words for people before sending off?
Shoot. I've been on this podcast before.
Yeah.
So,
well, outside of, I mean, I highly recommend people go check out Heal Thyself podcast and any other stuff, but it's just words of like.
Yeah. Final words.
Yeah.
Do what you're empowered to do. Turning off your TV. Do what you're empowered to do. Going outside. It doesn't matter if there's sun or not. Being outside is so important. Taking your shoes off, putting it on earth surfaces, eating a variety of plant-based foods, different colors, getting all those antioxidants, not only for your respiratory system, but for your immune system as a whole, reducing oxidation, and then do some stress relief. Either yoga, exercise at your house, breath work, get one of your bands that I was using when I was in Palm Springs, like, just do something. And those things are what you're empowered to do.
Awesome. And then check out your podcast, obviously.
Check out our podcast, Heal Thyself.
I'm very impressed. I'm not going to just try to blow smoke up your ass and pitch your podcast, but I'm really impressed. You're one of the few podcasts that I actually listen to.
Thank you.
I love your breakdowns of stuff. You're like an impressive human being.
I'm trying to keep up with you.
It's fucking great. Anything else?
It's all love. It's all love.
All right. Over and out. Thanks so much for tuning in.
Right.
And yeah, stay safe out there. Thank you all so much for tuning in to that conversation. As I mentioned previously, I hope you take everything that you're hearing in podcasts, that you're hearing from experts of all sorts, that you're hearing in mainstream media on the news, everything with a grain of salt, because truly information is changing. It's fluctuating so fast. You know, everything that you hear, it's like dog years, corona years. You know, a few days passes and then all of a sudden the whole world is different. So I think that people are, you know, like Dr. Christian Gonzalez, are doing their damnedest to stay up to date with what the heck is going on. And that's what we are doing with this conversation. So I hope it's helpful to you, and I hope that you found some good tidbits in there. If you did and you want to share them, you can share them on Instagram, be a fine place, or wherever you're into doing your shares. You can tag me at Aligned Podcast, and you can tag Dr. G at Dr.G_ on the Instagram. So greatly appreciate you guys sharing this with your friends. And if you want to learn how to sit in a more effective fashion, you can jump over to alignpodcast.com, where I give y'all a free video tutorial breakdown on how to sit more effectively, also how to stand more effectively if you're using a standing desk, and also how to be on the ground. So all these things, it's not about what you do, it's about how you do it. And in that video that you'll find on alignpodcast.com, you will learn exactly how to do you a bit more effectively. Thank you guys so much for tuning in, and we'll see you next week.